Peripheral Artery Disease, PAD, What You Need to Know. Unveiling Peripheral Artery Disease. Do you ever experience leg pain or cramping when you walk, only for it to disappear when you rest? This common yet often dismissed discomfort might be a sign of peripheral artery disease, or PAD. PAD is a widespread condition characterized by narrowed arteries that reduce blood flow, most commonly affecting the legs, but sometimes extending to the arms. These arteries are crucial because they are responsible for carrying oxygen-rich blood away from the heart to other vital parts of the body. This condition is far more prevalent than many realize, impacting millions of individuals across diverse demographics worldwide. In the United States alone, it affects upwards of 5 to 6 million people, cutting across various classes, ages, and races. The primary underlying cause of PAD is atherosclerosis, a gradual process where fatty deposits, known as plaque, accumulate on the inner walls of the arteries. This plaque progressively narrows the arterial pathways, significantly limiting the vital blood flow needed by muscles and tissues. A significant challenge with PAD is its often silent nature. A considerable number of individuals have the condition without even realizing it. This lack of awareness poses a substantial public health concern. When PAD remains undiagnosed, individuals are unknowingly exposed to a heightened risk of severe complications, including critical limb ischemia, which can lead to amputation, and systemic events such as heart attack and stroke. The fact that so many cases go undetected underscores the urgent need for greater public understanding and proactive screening, particularly among those with existing risk factors. Early recognition is paramount for effective intervention and improved long-term health outcomes. The silent culprit: understanding PAD's causes and risk factors. Atherosclerosis stands as the most common cause of peripheral artery disease. This process begins when an excess of cholesterol in the bloodstream, along with other substances, forms deposits called plaque on the artery walls. Over time, this plaque hardens and accumulates, causing the artery to narrow or become blocked entirely, thereby significantly reducing blood flow. In some instances, a plaque can rupture, triggering the formation of a blood clot that further obstructs the artery and severely impedes circulation. While atherosclerosis is the predominant factor, less common causes of PAD can include inflammation of blood vessels, direct injury to the arms or legs, structural changes in muscles or ligaments, and even exposure to radiation. Several factors significantly increase an individual's likelihood of developing PAD. Some of these are non-modifiable, meaning they cannot be changed. These include advancing age, particularly after 65 or after 50 if other risk factors for atherosclerosis are present. For individuals under 50, type 2 diabetes combined with another atherosclerosis risk factor also elevates susceptibility. A family history of peripheral artery disease, heart disease, or stroke further contributes to risk, as does race, with Black individuals facing a higher inherent risk for PAD. However, many critical risk factors are modifiable, offering substantial opportunities for prevention and management. Smoking and any form of tobacco use are paramount among these, recognized as a major contributor to PAD and a significant amplifier of risk for heart attack and stroke. Other controllable factors include diabetes, especially type 2, which is associated with poorer outcomes for those with PAD. High blood pressure, elevated cholesterol levels, and obesity are also significant contributors to arterial plaque buildup. A sedentary lifestyle or insufficient physical activity, diets rich in saturated fats, chronic kidney disease, and even unmanaged stress can further increase the risk of PAD. Understanding these risk factors reveals a crucial connection. PAD is not merely a localized issue affecting the legs. It serves as a powerful indicator of widespread atherosclerosis throughout the entire body. The presence of plaque buildup in the peripheral arteries strongly suggests that similar arterial disease is likely present or developing in other vital vascular beds, such as those supplying the heart and brain. This means that a diagnosis of PAD should prompt a comprehensive evaluation of an individual's overall cardiovascular risk. Recognizing PAD as a systemic condition rather than an isolated problem highlights its profound implications for an individual's broader health, emphasizing the critical need for early intervention to mitigate the heightened likelihood of concurrent or future heart attack and stroke. Decoding the signals, recognizing PAD symptoms. The most common and classic symptom of peripheral artery disease is known as claudication. This manifests as muscle pain or cramping, frequently felt in the calves, but it can also occur in the hips, thighs, or buttocks, and sometimes even the arms. The defining characteristic of claudication is its consistent pattern. The pain reliably begins with exercise or activity, such as walking or climbing stairs, and equally reliably subsides with rest, typically within about 10 minutes. This discomfort arises because the leg muscles are not receiving an adequate supply of oxygen-rich blood to meet their increased demand during physical exertion. Beyond claudication, other signs can point to PAD. Individuals might notice a distinct coldness in one lower leg or foot, especially when compared to the other side. Leg numbness or weakness is another common indicator, potentially causing the feeling of imbalance or making walking more challenging. A weak or absent pulse in the legs or feet is a direct physical sign of reduced blood flow. Visual cues can include shiny skin on the legs. Changes in skin color, such as paleness, discoloration, or a bluish tint. Additionally, slow-growing toenails or poor nail growth and hair loss or slower hair growth on the legs may be observed. For men, erectile dysfunction can also be a symptom. Some individuals may also report a sensation of pins and needles in their leg or foot. As PAD progresses, symptoms can become significantly more severe. This includes the onset of pain in the leg and foot, even when at rest, particularly at night while lying flat. This advanced stage is known as ischemic rest pain or critical limb ischemia, and the burning or aching sensation can be intense enough to disrupt sleep. Another grave sign is the appearance of open sores or wounds on the toes, feet, or legs that are slow to heal or simply refuse to close. These non-healing sores are highly susceptible to infection, which can become severe and spread rapidly. It is critically important to recognize that the highly variable and often non-specific nature of PAD symptoms is a major reason for its frequent underdiagnosis. Many individuals mistakenly attribute PAD symptoms to other conditions, such as arthritis in the hip, ankle, or foot, leading to delayed medical attention. Alarmingly, healthcare professionals themselves often overlook or misdiagnose PAD. A substantial proportion of individuals with PAD may present with atypical symptoms, or in some cases, no symptoms at all, particularly in the early stages. Symptoms often do not become obvious until an artery has narrowed by 60% or more, by which point the disease is already quite advanced. This variability underscores the need for healthcare providers to maintain a high index of suspicion, especially when evaluating patients with known risk factors, and for the public to be educated on the full spectrum of potential signs beyond just the classic leg pain with walking, thereby facilitating earlier detection and intervention. Beyond the legs, the serious complications of PAD. Peripheral artery disease is far more than a localized problem affecting only the legs. It is a serious systemic condition that signals widespread atherosclerosis throughout the entire body. This critical understanding means that individuals diagnosed with PAD face a significantly heightened risk for other major cardiovascular events, most notably heart attack and stroke. The very same fatty plaque buildup that narrows and hardens arteries in the legs can concurrently compromise blood vessels in other vital organs, including the heart and brain. Therefore, the presence of PAD serves as a powerful warning sign, indicating an increased likelihood of life-threatening cardiovascular incidents. One of the most severe limb-specific complications of PAD is critical limb ischemia, or CLI, representing the most advanced stage of arterial disease in the legs. In this dire condition, the extreme lack of blood flow leads to tissue death, resulting in relentless pain even at rest, and the development of open sores or wounds on the limbs that fail to heal. If left untreated, CLI can tragically progress to gangrene, a condition where tissue decay necessitates amputation of the affected limb to prevent further spread of infection and preserve life. Beyond limb-threatening issues, the complications of PAD extend to impact overall cardiovascular health and quality of life profoundly. The consistent and strong link between PAD and an increased risk of heart attack and stroke transforms PAD from what might seem like a localized vascular problem into a systemic disease with life-threatening implications. This connection arises because atherosclerosis, the underlying cause of PAD, is a generalized disease process affecting arteries throughout the body. Thus, if plaque is causing issues in the legs, it is highly probable that similar blockages are present or developing in the coronary arteries, supplying the heart, and carotid arteries supplying the brain. This necessitates a holistic and aggressive approach to patient care, emphasizing that managing PAD is not solely about preserving a limb, but fundamentally about mitigating the risk of major cardiovascular morbidity and mortality across the entire body. In some cases, PAD can also lead to poor circulation to the kidneys, potentially resulting in high blood pressure that is difficult to control, or even progressing to a loss of kidney function or kidney failure. The path to diagnosis: what your doctor looks for. Early diagnosis of peripheral artery disease is of paramount importance for effective management and critically for preventing the severe complications discussed earlier. The diagnostic process typically begins with your healthcare provider conducting a thorough physical examination, reviewing your comprehensive medical history, and carefully assessing your individual risk factors for PAD. During this examination, the provider will specifically check for a weak or absent pulse in your legs and feet, which can be an early and direct indicator of reduced blood flow. If PAD is suspected based on this initial assessment, your doctor may order several common, painless, and non-invasive tests to confirm the diagnosis and determine the severity of the condition. The Ankle-Brachial Index, or ABI, is often the first and most common test for PAD. This simple procedure involves placing blood pressure cuffs on your ankle and comparing the blood pressure reading to that in your arm. A significantly lower pressure in the ankle suggests reduced blood flow, indicative of PAD. Another valuable non-invasive test is the pulse volume recording, or PVR test, which quickly measures blood pressure and blood flow in your legs using ultrasound technology. PVR is particularly useful for identifying areas of partially blocked arteries and can provide more accurate results in individuals whose arteries have hardened due to conditions like diabetes or chronic kidney disease. Vascular ultrasound, also known as arterial duplex ultrasound, utilizes high-frequency sound waves to directly visualize blood flow through your arteries, allowing healthcare providers to pinpoint narrowed or blocked areas. Lastly, if resting test results are normal, but an individual continues to experience unexplained symptoms, such as leg pain with exercise, an exercise stress test may be recommended. This involves walking on a treadmill while blood pressure in the lower extremities is measured before and after the activity. In certain situations, particularly when more precise mapping of blockages is needed for surgical intervention, an invasive test called an angiogram may be required to pinpoint artery blockages. The availability of simple, non-invasive diagnostic tools like the Ankle-Brachial Index and pulse volume recording presents a stark contrast to the high rate of undiagnosed PAD. This disparity highlights a critical opportunity for proactive screening, especially within primary care settings. The ease, low cost, and non-invasive nature of these tests make them ideal candidates for routine application, particularly for individuals with multiple risk factors, such as chronic smokers, diabetics, or those with high blood pressure and cholesterol. Implementing more widespread and routine screening could significantly bridge the gap between PAD prevalence and diagnosis, thereby enabling earlier intervention. This proactive approach would allow for timely initiation of lifestyle modifications and medical management before the disease progresses to severe complications like critical limb ischemia, potential amputation, or systemic cardiovascular events such as heart attack and stroke. Empowering health, treatment, and prevention strategies. Managing peripheral artery disease requires a fundamental understanding that it is a chronic condition demanding a lifelong commitment to both medical and lifestyle therapies. It is crucial to recognize that even advanced surgical interventions alone do not provide lasting benefits without this ongoing, dedicated commitment. The success and longevity of any treatment, including complex procedures, are heavily reliant on the individual's sustained adherence to a heart-healthy lifestyle. Lifestyle modifications often serve as the initial and most crucial approach to treating PAD, particularly in its early stages. These changes can effectively slow or even halt the disease's progression, and in some cases, allow the body to develop alternative channels for blood to bypass existing blockages. Some studies even indicate that PAD symptoms can be reversed through consistent exercise and diligent control of cholesterol and blood pressure. Quitting smoking and all forms of tobacco use is paramount. As a major risk factor, cessation will profoundly slow PAD progression and drastically reduce the risks of heart attack and stroke. Support resources like behavior modification programs or nicotine replacement therapies can be invaluable. Adopting a heart-healthy diet is equally vital, emphasizing vegetables, fruits, and whole grains, along with lean proteins, low-fat dairy, and non-tropical vegetable oils like olive oil, while limiting sugar, trans fats, saturated fats, sodium, and red meat. Engaging in regular physical activity, even if walking initially causes pain, is an effective treatment for PAD symptoms. Supervised exercise training or structured walking programs involving alternating periods of activity and rest can gradually build tolerance and walking distance, as exercise helps muscles utilize oxygen more efficiently, even with reduced blood flow. Always consult a healthcare team for personalized exercise recommendations. Maintaining a healthy weight, getting adequate sleep, and effectively managing stress are also integral components of comprehensive PAD management. Diligent management of underlying health conditions such as diabetes, high blood pressure, and high cholesterol is critically important, with good glucose control for diabetics significantly reducing limb-related complications. When lifestyle changes alone are insufficient or to further control risk factors, medical management with prescribed medications becomes necessary. Antiplatelet medications, such as aspirin or clopidogrel, are commonly prescribed to prevent dangerous blood clots. Cholesterol-lowering medications, like statins, help reduce harmful cholesterol levels, while high blood pressure medications, including ACE inhibitors or ARBs, are recommended for those with PAD and hypertension. Oral anticoagulants, such as rivaroxaban, may be used to further decrease blood clot formation. For individuals experiencing claudication, a specific medication like cilostazol may be prescribed to improve walking distance and alleviate leg symptoms. Additionally, individuals with PAD should receive an annual flu vaccine and stay updated on COVID vaccinations and boosters. For severe PAD, particularly critical limb-threatening ischemia where the health of the limb is compromised, additional medical or surgical interventions may be required. Less invasive endovascular treatments include angioplasty, where a balloon-tipped catheter is used to expand the narrowed artery and flatten plaque, often followed by the placement of a mesh metal stent to keep the artery open. Some catheters can also physically remove plaque through scraping or laser destruction. In other cases, bypass surgery may be performed, where a blood vessel from another part of the body or an artificial vessel is used to create a new pathway around the blockage, restoring blood flow to the affected limb. Even with these advanced interventions, the underlying cause of PAD, atherosclerosis, is a chronic, progressive disease driven by lifestyle factors. While procedures can acutely restore blood flow, they do not cure the systemic disease. Therefore, a lifelong commitment to lifestyle and medical therapies remains absolutely essential for long-term success, preventing recurrence and ensuring the longevity of the intervention. This reinforces that patient empowerment through sustained behavioral change is paramount for the overall efficacy and durability of any medical or surgical treatment. Conclusion: taking charge of your health. Peripheral artery disease is a common yet serious condition stemming from narrowed arteries, often remaining silent in its early stages. Despite its subtle onset, PAD carries significant risks for severe complications, including critical limb ischemia, which can lead to potential limb loss and a substantially increased likelihood of life-threatening events such as heart attack and stroke. Understanding its diverse symptoms and recognizing the underlying risk factors are therefore critically important. The journey to managing PAD and safeguarding overall health begins with proactive engagement. Individuals are encouraged to take charge of their health by adopting and consistently maintaining heart-healthy lifestyle habits. This includes making the vital decision to quit smoking, embracing a nutritious, heart-healthy diet, engaging in regular physical activity, and diligently managing weight and stress levels. It is equally paramount to consistently manage any existing conditions such as diabetes, high blood pressure, and high cholesterol. If any of the discussed risk factors apply, or if any of the mentioned symptoms are experienced, consulting a healthcare professional without delay is strongly advised. With early diagnosis and consistent, proactive management, individuals can significantly improve their outcomes, maintain their quality of life, and live healthier, more fulfilling lives despite a PAD diagnosis.